Good afternoon. My name is Dr. Joan Reed. I'm Dean for Diversity and Community Partnership here at Harvard Medical School, and I want to welcome you to our Leadership Forum. It's wonderful to have members of our community from across our schools and our hospitals joined here today to welcome Dr. Donna Shalala, Secretary Shalala, for a talk on universal health care, an idea whose time has come. For me, this is a particular honor because in my world I have sheroes, heroes and sheroes, and Dr. Shalala is one of my sheroes. So it's wonderful to be sitting here with her. She is Trustee Professor of Political Science and Health Policy at the University of Miami, served as President of the Clinton Foundation and President of the University of Miami, President of Hunter College, City University of New York, Chancellor of the University of Wisconsin-Madison. If that's not enough for her to be my shero, all right. She's had professorships at Columbia and at City. She is one of the most honored academics of her generation and of many generations. She's been elected to 7 national academies, National Academy of Education, Public Administration, Arts and Sciences, Philosophical Society, Social Insurance, Political and Social Science, and the Academy of Medicine. For 8 years, she held the post of Secretary of Health and Human Services and served with President Clinton. President George W. Bush nominated her as co-chair of the Presidential Commission on Care for Returning Warriors. And in 2008, President Bush presented her with the Presidential Medal of Freedom. She's named the best in so many things and has received so many honors and awards. One of the ones that strikes me, because I talked about my sheroes and heroes, she received the Nelson Mandela Award for Health and Human Rights. She received the National Academy of Medicine's David Rail Medal. Honored by institutions, the Academy, government, someone who years ago for our Commonwealth Fellowship, and I'm not even sure if she remembers, actually had one of our fellows spent some time, Nawal Noor, with her in Washington. So she has been a supporter of women, a supporter of students, a supporter of diversity for a number of years. So please all join me in welcoming Dr. Donna Shalala. Thank you. Thank you very much. So this is a leadership forum that's part of the Commonwealth Fund Mullen Fellowship in Minority Health Policy. And Jim Mullen is someone that you knew well.
I did know Jim Mullen, probably the best health policy person I knew, who had a particular passion for vulnerable populations, as you well know. But I tried to hire him 6 times. I think every year I was in government, I call him up and say, Jim, when are you going to come and join us? And I just could never get him to come back. He, of course, had spent time in Washington, but I offered him initially, when I first became secretary, every position in the department. And I just couldn't get him to come. He said, I'll be an advisor, so he's always at the other end of the phone. But he was an extraordinary human being.
What made him special as you talk about him?
He had passion. He not only had smarts, it wasn't just knowing the programs, but he was focused and he had passion. And he wanted great institutions to focus on not just be patient-centered, but to understand who the patients were.
Important.
And I learned a lot from him over the years, just in quick conversations. I'd pick up the phone and call him and say, we're dealing with this thing. What do you think?
Jim Mullen was integral in our forming this Commonwealth Fund Fellowship. Jim Mullen was important in Boston in terms of Mass General and partners in healthcare. He was important in terms of health insurance and moving towards universal health care, which we've never fully achieved. But you had a lot to do with this, moving us towards providing health care to a larger part of our population. What has this journey been like for you towards universal health care?
Well, I'm a political scientist, so I've always been fascinated by social movements and what it took to take giant steps in social policy, particularly at the federal level, though I was trained as a state and local person, and I particularly love states and states experimenting in social policy, and that's how we got Social Security and Medicare. If you think back, we were really already playing around, and welfare policy, really. We were experimenting at the state level with different approaches and learned a lot from that. So filling in the gaps, understanding why it's so complicated to simply say Medicare for all or we're going to go to a single payer system has been almost a life's journey for me. I still have marks on my back from the Clinton healthcare plan. But we pivoted fast and covered working class kids with the Children's Health Insurance Program and covered more disabled, thanks to Senator Kennedy and Senator Kassenbaum in our existing Medicare and Medicaid programs. So we've been moving towards covering more and more of the population that could not be covered by the private sector, in which employer-based care could not was not going to work, and in which the private sector didn't really want to participate. I mean, they want to participate in delivering the programs, but they certainly don't, from a financial point of view, think that it's viable for them to offer plans to people that can't afford to pay what they think is necessary for insurance. So we've been moving towards this, but only where we've had some consensus in the country that that population couldn't be covered by the private sector.
When you look at where
could we
are
take
today,
a step?
When
Yeah.
you look at where we are today, are we closer to covering those populations? Are we moving back from covering
No,
those
we're very
populations?
close. We're much closer. Thanks to Obamacare, the expansion of Medicaid, even though we didn't do it in every state, and the addition of the exchanges, we're covering now a very high percentage of the total population. We still have groups we're not covering. Young people still don't want to pay anything for their health insurance. Well, we got them all covered. If parents had health insurance and we covered them to 26, probably should have done it to 30, given the way young people behave these days. But yeah, we're much closer. We have some more work to do. Those expansions of Medicaid programs are important. Massachusetts is going to let some people buy into Medicaid. But we shouldn't only be thinking about insurance, because we do have bipartisan support for expanding clinics. But the big challenge for federally qualified clinics is, can they link with an academic health center to take care of the specialist kind of care that they need? So, when I talk about coverage, I'm not just talking about insurance. President Obama moved us very far along. President Clinton did his piece. President Bush did the drug piece. So we've done it in an incremental way within the existing politics and the existing system. And that's the way our politics works for the most part. We don't do very dramatic things because we don't have a system to do very dramatic things. We have committees of Congress. We have checks and balances. We have courts. But we've come a very long way.
When you think about the rest of the way we need to go, and you've talked about some things done at a state level or a local level and experiments and bring this forward, what do you think it will take us to move the needle a little bit further?
If I was in office now, I would use the waiver authority of the department to help states to expand, the way we did, to help them expand their coverage. Massachusetts got to expand its coverage because it used a lot of federal money. It had very few people that weren't covered. Now, if you live in Massachusetts, you think there were a lot of people that weren't covered. But if you look at the total percentage, it had one of the lowest percentages. And the federal government let them use federal money and leverage more federal money in an unusual way using the waiver authority. So I'm a great believer, and actually I learned some of this from Mary Jo Bain, who was the executive dean over at the Kennedy School, on welfare reform. I just, using the states, they used to be laboratories of experimentation, using the states to let the good states try out this thing. Tommy Thompson did a terrific job in Wisconsin, expanding coverage both in welfare as well as in healthcare, and came up for innovative ways of getting people covered. But we need to get the subsidies right. We knew when Obamacare was put in place, we probably didn't get the subsidies completely right. Probably should have extended them a little bit more into the middle class that didn't have jobs and companies that gave them good health care. So, but normally, under a normal political system, you would make technical corrections by now. You would have had pivoted and made some corrections on the existing system. And then there are young people. And while we made catastrophic coverage available, mostly to protect their parents, not to protect them, we've got to figure out a way, because young people are worse, almost worse than old people. They don't want to pay very much out of their existing income. So we've got to figure out a way. And then the federally qualified health centers, where there's bipartisan support, can be very good healthcare homes. Frankly, most of the people who walk into those places have health insurance. They just don't have any place to go for access. So there are a variety of ways to get coverage. And when we think about universal coverage, it seems to me we've just got to be much more creative about making sure people have comprehensive coverage, but it doesn't necessarily have to be with an insurance card.
For some people, they're talking about this feel of moving back and feeling somewhat discouraged. Can you talk a little bit about times that you have seen where we've moved forward, come back, so sort of the forward I go, the behinder I get, going back and forth, a slow pace towards
Yeah,
real
you know, I
change?
lived during Republican eras when most of it, the rollback was in terms of women's health and abortion rights and other kinds of things. In many ways, we found ways around it with private money and building not-for-profit organizations. It's been particularly bitter, though, to see what we've done abroad in those areas where we've made considerable progress in women's health and women's education, to see some of that money being rolled back. But we've been inching ahead for a long time. And Senator Kennedy said to me before he passed away, he actually lived in Miami before he passed away. Most people don't know that, but his family wanted to recreate the summer for him. So he came down and we took care of his health care. And I visited him while he was there. He said, "I wish I had signed up for the Nixon plan." What was the Nixon plan? It was basically Obamacare with more flexibility for Medicaid in the states. He said, "I thought I could do better." This is why politics is always a judgment call. He said, "I thought I could do better, but if I had signed up for the Nixon plan, we would be so much further in terms of universal coverage than we are now." And it tells you something about politics and judgment and where you are and where you stand. And even someone as distinguished and broad-based as Teddy Kennedy, you know, looked back and said he saw that opportunity, but he decided he could do better.
What this makes me think of, though, is if you think of the Nixon plan, it wasn't the Democrats, it was the Republicans. And
No.
now you have Obama with the Democrats. And the ways in which these can go to either party.
Yes, it's true. And even if you look at the deal that Lyndon Johnson cut with the Southern Democrats, they weren't interested in Medicare. They were interested in Medicaid. They wanted to put money into the South. They loved the income-tested programs because they knew under that formula, because of the low incomes in the South, they'd be pouring money into the South. So the largest employers in Mississippi, Alabama, is Medicaid. So they knew what they were getting. So they cut this incredible deal from their point of view of getting Medicaid connected with Medicare. And Lyndon Johnson, even though he was a Southerner, was more interested in the Medicare piece because he was trying to fulfill Harry Truman's legacy at the time. So you have to have historical context. When you sit where I sat at HHS, you've got to have historical context when you're looking at these policies. You have to have a broader sense of what it takes to take a giant step in terms of policy.
And be open to all of these different sides. One of the things that has struck me as I've looked at the places that you've been, from Miami to government, you have advanced diversity in all of these places. It's been a component. Can you talk a little bit about why that's important, or is it important, and why?
Well, from a policy-making position, unless you have diverse policymakers, you get it wrong every time. Unless you understand the populations that you're dealing with, and that includes the leadership of a university or the leadership of HHS. But my whole career, I've been as interested in economic diversity as I have in racial diversity. Let me tell you why. At HHS, we had these big policy-making tables. I mean, I never had a meeting just with the 4 top political appointees. I never had a meeting with just political appointees. I always had the senior civil servants. They knew more than we did, even though we had experts in every subject around the table. But when I picked the team, I didn't pick everybody that grew up in a white suburb and went to an Ivy League institution, with all due respect. I picked people of genuine, diverse backgrounds for each of the agency, the big agencies. So one of the big agency heads had rickets as a child. Who do you know that has rickets as a child? I mean, she grew up in real poverty. You have to have someone sitting at your table that understands what it's like to be poor in America. And a minority. It's not just being a minority in America. It's also being poor in America, being middle class, coming from the South, from the North. So when I pick a team, I want a team that reflects, not just simply reflects the country, but reflects the populations that we want to serve. Bob Williams, who Mary Jo Bain recruited, who was head of our disability agency, was an extraordinary figure. He had polio as a child. He had cerebral palsy as a child. Spoke to us through a computer. He sat in those meetings, and I went around the table every time to get everybody's comments. And I always started in the middle of the table to give him enough time to get his message out. And everybody was invited to every big policy decision because you never knew what insight you would get from everybody around the table with their different backgrounds. Mary Jo Bain is a perfect example. She was a working class kid, Catholic, deeply committed Catholic, who had lots of social service experience delivering. And David Elwood was had a completely different background, the son of a doctor. But everybody around the table had a different background, and that was important to me because it's important not only to understand the different cultural backgrounds and how they'd handle different issues, but it was important to me that they saw the world from different eyes, because the worst thing for a cabinet secretary is for someone to leave out some information. Being snookered is the worst thing you could do to a cabinet officer. If you leave out information or insight, you don't make good policy. So I was rabid about having large tables and having different people with different backgrounds. You'll hear very few people in leadership talk about economic diversity. They all talk about racial diversity, but not with. But economic diversity, from my point of view, is just as important.
Within that, I'm a blatant hero worshiper. I said that from the start.
I think you should get over that.
No, because it's not often I get to have this. So I'm going to relish this moment while I have it. For you, who have held so many positions in so many places, as a woman in these positions, okay, so you're a political scientist also, words for what it means to step in those positions for you, for other women.
I'm not a queen bee type. I've always helped other women, particularly minority women. But I've helped med too along my career. I was, someone said to me the other day, were you ever discriminated against? Yeah, my first job, well, graduate school. The chairman of my department said, I'm not going to give you money because women don't finish their PhDs. Oh my God. I went running to the dean and he sort of slapped the guy on the head or something. And made sure I had a proper assistantship. My first job, the chairman of the department told me they'd never give a woman tenure. And not only that, I had embarrassed the department because I had published more than the entire department put together. After that, as I achieved power, no one messed with me. No one messes with you. When I was an assistant secretary, I used to go to the Hill. If I took a male assistant, I was the assistant secretary for policy at HUD in the Carter administration. If I took a male assistant, the member of Congress would talk to the male assistant. If I took a female assistant, they'd talk to me. We used to test it. The guys thought it was hysterical, so we used to test it depending on which member of Congress we were talking to. But once you become a cabinet officer, people really don't, or a college president, they really don't mess with you because you have real power.
The goal there. When I hear this and I hear you talk about these issues, what comes to mind is there must be this core set of values that guide you in terms of your thinking and your approach. What are those and where do they come from?
Well, they come from my family, obviously. I come from an extended Lebanese family, and I grew up in a very secure environment. All my cousins and aunts and uncles live within a 2-block area, and my grandparents were in the area as well. And I grew up with adults too. I'm astounded at the Thanksgiving table that I go to now, that the kids sit at a kid's table. When I was a kid growing up, you got to sit with the adults. And you ran to sit next to your favorite uncle or aunt. You never wanted to sit next to your parents. You ran to sit next to your... And that was a maturing experience for kids. And why we decided that we should separate the kids from the adults now, I find the kids more interested. Sometimes I sit with the kids' table just to find out what they're talking about these days. So I grew up in a very secure environment with real values. My parents, I went to a technical high school. My family was working class, though my mother eventually went to law school. She was a teacher, but she eventually went to law school. But I grew up with people from different backgrounds. I went to high school with African Americans and Hispanics, and in Cleveland, every ethnic group is represented. In fact, when I got to Hunter, I was the only one that could pronounce everybody's name because I had grown up in that kind of a neighborhood. My parents were Arab Americans, but they were not anti-Semitic. My grandmother had great Jewish friends in Lebanon, and we were Catholic, Maronite Catholic. So I grew up in this very secure, with real values, how you treated people. I was a competitive tennis player. My mother was a competitive tennis player. She would pull me off a court if I was disrespectful in any way. So I grew up with some real values. But at the end of the day, it was my Peace Corps experience, living in a mud village in southern Iran, that really set those values in place and made me a citizen of the world. I was better at that job than anything I had after that. I was really good. You plunk me down in a mud village someplace, and I can get them all organized. Like most young Americans, I had organized in college, so. And those were the early days of the Peace Corps when they had no idea what we were doing or where we were. They had no bureaucracy.
Did those skills help you as you moved to university or
Absolutely.
HSS?
Absolutely. Every job I had, probably until I got to the Miami job, the consensus was I wasn't qualified. I just moved from job to job through opportunities in which the consensus really was I wasn't qualified. I went to HUD in my late 20s as an assistant secretary. No one was being an assistant secretary, but Jimmy Carter was so desperate to get women, they plunked us down into these jobs. I went to Hunter when I hadn't done nothing more than headed a program at a big program at Teachers College, a PhD program at Teachers College. As president, I didn't have a clue how to run a 24,000 student institution, but I learned, and when I went to Wisconsin, they were horrified. They had come from this little Hunter College in New York. And when I went to HHS, the press reported that I was totally unqualified, even though I had run a major research university. So going into a place where they don't think you're qualified is a good idea, because then you learn to listen and to co-opt the civil service or the locals and figure out how to do the job. And every place I went, the bureaucracy embraced me and helped me to do the job better.
What was it in you or how you were brought up that allowed you to take these leaps, to take these risks?
I just am an adventurer. When I finished college, I applied to law school, to medical school, to a PhD program, to the Peace Corps. I laid all the options out after I got accepted in a whole bunch of things and said, what would be the best adventure? I picked the Peace Corps. The rest is history. I went to graduate school because I was following my boyfriend. I had no intention of being an academic. I wanted to be a journalist. But I loved graduate school. He hated it, so he left, and I stayed. So I don't have one of those careers where I was, I decided when I was 7 years old I wanted to be a doctor. I took advantage of opportunities, and I had a kind of, not an arrogance, but a kind of security, and I really like people. I like young people, I like people. And that makes a difference. And just learning, and I was very well trained as an undergraduate in graduate school. My favorite public health story is the story of when the flu shots came in the early 90s. We were trying to get seniors to sign up, and they wouldn't sign up. So like good bureaucrats, we spent $1 million on a campaign. And we raised the number of seniors by 3%, 4%. I mean, it was terrible. And so I was so upset that, and everybody wanted to spend another $1 million. And I said, why don't you go out and do a little survey research and find out why they're not signing up? They went out there, and it told us nothing. And I said, well, let's do focus groups. So I actually sat in on one, and here's what the seniors said to us. The federal fiscal year started October 1st. That's when we wanted people to. Their deductible started October 1st, and they saved their deductible, which at that time was $100, for something important, like an operation. And they weren't willing to reach into their pockets and pay the $5 for a flu shot. So we exempted the flu shot from the deductible, and we got an 80% take-up. Now, who in some public health or medical school in the world teaches people to connect the deductible with patient behavior that will have a dramatic effect on whether people live or die? I mean, that's the kind of thing that well-trained people who like people and are willing to listen to them will pick up. But you have to have a certain kind of rigor and a lot of humility to pick up that kind of thing. And it made a difference.
When you talk about that, this rigor, this humility, if you were looking for leaders now, what are the attributes that you're looking for? When you're selecting a Jim Mullen, you're selecting the other. What are you looking for?
I think brilliance is overrated. So you don't impress me if you were first in your class. You impress me with a resume in which you've done different things and learned different things along the way, even if you've stayed in the same institution. I'm interested in what you learned and how you handled difficult situations and whether you can work together as a team. I'm more interested in putting together a team than I am in individual brilliance. Even in the sciences, you don't look for that. I'm not afraid of strong personalities. After all, I've run universities with strong deans. That's why it was easy for me to run HHS. It was just like a big research university with a lot of very strong personalities that you had to, sort of keep in line with different cultures. CDC is very different from FDA and from NIH. They have different traditions, they have different cultures, but all of them had very strong leaders. And that wasn't much different than having a law school, a medical school, a public health school, arts and sciences. Geez, if you can manage arts and sciences, you can manage anything. So conceptually, I could handle something like HHS. So, but I wanted people that were going to be on a team, and I was going to use a series of exercises to wield them into a team. And so, you make some guesses after years of hiring people. I'm right about 70% of the time. I'm dead wrong about 30% of the time. So, and even when I'm dead wrong, I have to make them a part of the team. At HHS, I used the budget process to do that. I made everybody sit in everybody else's budget process. Can you imagine Harold Varmus had to sit in the FDA budget process? And then I gave them a worksheet that said, you do the department's budget. First year, they all gave themselves more money. Last year, they were giving each other money. Because they were learning where there were overlaps, they were developing relationships. You can't break down the silos completely, but you can get people to work together. And when I went to the department, all of the awards were for individuals. When I left, they were all for groups, for teams, because we put together teams, and everybody said the best experience they had had in government was working together on a team on a big problem. Had to be a very specific problem. So leadership learns that over a period of time. But again, I'm less impressed with brilliance and ability to absorb information than I am ability to work together and to have real interpersonal skills. And charm is not necessarily an interpersonal skill. But it's more a judgment call. At this point in my career, I trust my gut more than I do overanalyzing and reading resumes too carefully, though you have to read them.
There's a friend of mine, Ron David, who used to be at the Kennedy School, who says, relationships are everything, all else is derivative.
Interesting. That certainly is true in working with Congress. I used to solve people's problems. Republicans would call me and they'd have these problems that would cause problems within the department. A very conservative Republican called me from Nebraska once and said, I've got this terrible problem. My little town has a hospital which has 14 beds, and they didn't apply for some grant program that you've closed. And so I went to the person that was in charge, and he said, we can't do that. You can't break your own rules. We set the time. I said, well, they don't have a consultant like everybody else. And he said, we just can't. It's a precedent. You can't do something like that. And so I went to the general counsel. I said, do I have the power to write a waiver? And she said, yes, but I don't recommend you do it. I said, well, who's going to sue us? I said, if anyone else come in with this problem for a 14-bed hospital in Nebraska, I said, so write a narrow waiver that waives the rule for hospitals under 20 beds in rural America. That congressman would do anything for me. I think I got him on the NAFTA vote or something. But he would do anything for me. Government officials need to be human too. But I did a lot of favors for Republicans and Democrats. But it was those kind of favors. They asked me, the Mississippi senators asked me to solve the catfish problem in Mississippi. When I told them that was the Department of Agriculture's problem, because we didn't do fish, and they said, but you have the CDC. I said, I don't think the CDC does fish. So they said, but we can't get any help out of agriculture. So I called Jeff Copeland, the head of the CDC, who has this huge sense of humor. He said, Donna, we don't do fish. I said, I already said that to Mississippi. I said, don't you have some guys there that grew up in Mississippi that can go look at the catfish? He said, yeah, I got a couple of guys. So he sent them over. We solved the catfish problem. You can ask Trent Lott and Thad Cochran whether Shalala was supportive of Mississippi, and they'll say, she's our favorite Democratic cabinet member.
Took care of that. Are there mentors or people who helped you?
Yeah, there were lots of people that helped me along the way. Mostly males. I didn't really have any women mentors. I worked for Patricia Roberts Harris at HUD. I can't describe her as a mentor. She was tough, but more tough on the men than she was on the women. I worked then, she left to go to HHS. I told her I didn't want to go with her to HHS because I didn't feel like learning health policy. Can you imagine? I actually said that. I stayed with Moon Landrieu, and he was a different kind of Democrat. He taught me a lot about the small things in politics. Jimmy Carter started to charge the civil service for their parking. He said that was the dumbest thing you could do. He said for the few bucks you're going to get the entire civil service mad at you. So he taught me how to pay attention to small things, which cumulatively affected people's lives. So and I had very good graduate school mentors, people that really encouraged me. They wanted me to be a scholar. I wanted to be a journalist, and they eventually won because there were no journalism jobs.
I want to open this up. There's some microphones on either side, I think.
Sorry, that's not a cold. That's my sinuses finally breaking up.
When you look at the landscape today, what is your suggestion? I mean, you learn the importance of the small politics and of the relationships. Advice for how do we deal with what at times can feel like a shifting environment and hostile territory?
You can't act like it's hostile. You just have to behave like you're serving the people. The president nominates you. You're confirmed by the Senate so that you can serve the American people. And you just have to keep working through it. I lived through the Newt Gingrich era. Whoa. But I still had a lot of friends on the Republican side because we had been as good as we could possibly get. You can't imagine. My legislative people had this trick that the day they were all sworn in, they would take me up to the Hill because they'd all have their families there and they'd want pictures. We'd take a photographer with us. There was no other cabinet officer wandering on the Hill. The HHS secretary was a big deal walking into your office, some little new congressman's office. Got to meet the family, took a picture. My picture is in more congressional offices just because my legislative guys were smart enough to do that. That meant we could get people on the phone, and at least they'd listen to us when we made our pitch.
Understood what mattered.
Yeah, what mattered to them.
What mattered to other people.
What mattered to them. Well, we haven't gotten into universal health care. I was going to talk a little about that, but let's take some questions and I can.
Well, as we sort of queue up for the microphone, let's talk about that universal health care.
Yeah, I think my point is I had a question mark about an idea as time has come. The difficulty is that we know how to do it substantively. We don't know how to do it politically because people are making a lot of money over the fragmented system and the way it's organizing. And to get single payer, someone's going to make less money. Or they're going to shift, not that we're going to take money totally out of the system, but we're going to shift it around. And what the polls show is while people are for single payer, once you tell them it's going to affect their own health insurance, they back away. You say to me, for example, Medicare for all. I don't want Medicare. My health insurance is better than Medicare. Everybody at Harvard University has better health insurance than Medicare. And so either you have to level down everybody so we can have universal health care, or you got to put a lot more money into the system. And then you have the unions, which negotiated for years. This isn't just a right issue. They negotiated for years giving up salary for benefits. They're very wary about you doing. That's what the Clintons ran into. They tried to take on the whole system, and everybody said, don't touch my health care. I've got good health care. So it's complicated to try to take some people's health care away, to level down other health care. It's just the stakeholders are so powerful. That's why President Obama did coverage but didn't do cost containment. All he did was throw a lot of money into the system, and the politics were very difficult. He had to buy off the pharmaceuticals, the insurance companies, every major stakeholder by putting more resources into the system and promising he wouldn't raise their fees or their taxes at the same time. So the politics of getting universal health care, I don't know how to, as a political scientist, I don't know how to do it, given the stakeholders, unless you had a huge amount of money and all the stakeholders bought into it. It's not that the stakeholders don't want a simpler system. It's not that they're not for cost containment. They just want to know whose ox is going to be gored as part of this. And so And don't read it as I'm not for universal health care. I'm for universal health care. I just don't know how to do it in our political environment, Democrats or Republicans, because I see the left and the right both having qualms about it. Not that it isn't, you might think it's just the left is for it, not necessarily. Because it's more complicated than that, and particularly people that have good health insurance, that work for large companies or for universities, are going to be very wary if it's going to hit on their health care.
I wonder if, even when you say universal health care, if people have the same idea of what that means in terms of...
No, they don't. Of course they don't. But they do believe in everybody being covered. But they're going to... But as you talk to them about how it will affect what they have, then they start backing away. Look at the Kaiser polls, the Henry J. Kaiser Family Foundation polls. And what they show you is everybody's for universal health care until you start getting into the details of how it will affect their health insurance. And then people, it's the politics of repeal and replace. That once people started to think about what kind of an impact it's going to have when you take some money out of the system and have something simpler that you have to buy into, everybody says, wait a minute.
And where was the replace in the replace?
Well, there wasn't enough replace in the replace because it was really about tax reform. They needed the money for tax reform. Questions? Anyone? Either I talk too fast or I...
There.
Thank you very much. I don't know whether my question will be appropriate, but I come from Addis Ababa University in Ethiopia, so my question is more around global health.
Okay.
And universal health coverage. So one of the crucial barriers to health care coverage or access is access to essential medicines.
Yes.
And I know, for example, the Clinton Foundation supports a country like Ethiopia around vaccines, for example. One of the crucial shifts for me has to be in that kind of aid environment, has to be capacitating the countries to be able to produce their own products. And then the next layer of question comes. Those countries do not have that actual human resource capacity to be able to do that. So, for example, in Ethiopia, we have established a regional center to support the regions of Africa to be able to produce their own vaccines, medicines, diagnostics. But the question is we don't really have the human resources to be able to train peoples and so on. So is there any space for supporting things of that nature?
Yeah.
Yeah, thanks very much.
It's a very interesting questions. And of course, there's been a lot of work on countries trying to produce their own vaccines. I worked with Vietnam, for example, on producing vaccines with the Pasteur Institute, the French institute, on helping them to develop a capacity to produce some of their own vaccines in country. It takes a lot of technical support to do that. And one of the challenges is, what are our priorities? If we can get discounted vaccines, as we have through UNICEF and through other investments, is it worth it to develop the vaccine capacity or the country's own capacity to handle their own health crises? That so much of our focus and our priorities have been on building the infrastructure, helping countries to build the infrastructure so they can manage their own delivery system of quality health care. Rwanda has done some work, I think, and a number of countries in Africa have been better at this as they start to make investments in the infrastructure. You could see it during Ebola, where some countries could manage it because they had an infrastructure and other countries couldn't. Vaccine production, building that capacity, takes a big step. And it really is a question for the countries on what they think is the most important, particularly if discounted vaccines are available. And if quality discounted vaccines are available. And it really is a judgment call on which one you want to do. We've had trouble keeping the multinational pharmaceuticals in the vaccine business because the margins are so narrow. And in fact, I looked into, Michigan used to produce vaccines. They actually had a company in Michigan that produced vaccines. I looked into the possibility of states making investments in this country so we could produce our own vaccines because I was so frustrated with my conversations with the pharmaceutical companies. They just had things in their pipelines where they could make more money, and they weren't as excited about making vaccines. So we had to incentivize them in some ways and frankly beat them over the head in some ways to get them to produce vaccines. NIH is going much further now in the development of vaccines than it has before, with some production capacity, at least for doing the clinical trials. But it really is a judgment call on whether you think that building a capacity within a country that you'd have enough of a market to justify that versus getting deep subsidies from international organizations to purchase the vaccines. I happen to come down usually on the side of building capacity and training health professionals in countries so they can manage their own healthcare system for their populations. But it really is a judgment call.
Good afternoon. Thank you for sharing your wisdom. I have one, I guess, is more of a statement as opposed to a question, which is you talked about humility and leadership, and unfortunately, I think in our current political climate, we aren't necessarily seeing a lot of humility as opposed to bolstering. But I would love to hear more thoughts on how we can identify individuals who are humble yet still express great traits that could be potential leaders. And then secondly, can you speak a little bit more about the leverage that CMS could use to help contain costs with both covering Medicare and Medicaid? How can CMS be more of a player in helping us to control healthcare costs?
Yeah, let me answer the CMS question. They certainly, there are some other things they could do, but they're restricted by law from negotiating prices. That's their problem. Medicaid can negotiate prices. The VA can negotiate prices. Listen, I would pass a little bill that said whatever the VA pays, Medicare and Medicaid ought to pay. So they have limited leverage because of congressional restrictions, which Big Pharma has put on them. And unfortunately, the Obama administration had to cut a deal to just get the bill passed. But there's some indication that the current administration is interested in taking on the issue of drug costs. Now, whether they'll actually do it, they've just nominated someone for secretary who actually comes from Eli Lilly. But he's basically a good guy. I mean, as far as I'm concerned, he worked for Mike Leavitt. And he's as good a Republican as you're going to get. In fact, I was shocked that they took an establishment Republican who knew the department, who had been general counsel and deputy secretary. And I don't know whether he's going to get confirmed or not, or I've never met the man, but I have friends that know him. I don't think the fact he worked for Eli Lilly will necessarily do anything other than he'll be very knowledgeable about drug prices. One way of reducing drug prices would be to get rid of the advertising on television. Unfortunately, Senator Kennedy and Senator Frist cut the deal after I left at 3 o'clock in the morning in the middle of the negotiations. I thought the negotiation was over. They said, go home. When they said go home, I just assumed they weren't going to talk anymore. And they cut a deal for the reauthorization of FDA, and part of the deal was advertising for drugs. That has driven up, even Senator Frist admits today, that has driven up the cost of drugs. So there are some things that you could do. There's some capping you could do. Certainly the government is a big purchaser, could do more than it currently does. And the insurance companies, as they've bought up the secondary market for drugs, the middlemen are certainly going to start negotiating harder on prices. But I wouldn't look to CMS in particular unless there's some change in legislation. And I'm sorry, you had another question. Oh, humility. Vote for any member of Congress when you go to their town meeting that says, I don't know. That's my rule. Someone that doesn't know the answer to something is willing to admit it. But it takes a certain amount of arrogance to run for office in the first place, and self-confidence. But we need more people that say, I don't know the answer to that.
right here.
Hi, thank you. Oh, is that on? Okay, yes. Thank you for being here. I had a question I wanted to follow up, sort of thinking about domestic health coverage. There was an article
About what?
domestic health care coverage. There was an article a couple weeks ago in the New Yorker, Is Healthcare a Human Right? And actually, Tolgawande went and talked to people in Athens, Ohio, who he grew up with, people who were just not quite eligible for Medicaid. And it was a real, I don't know if other people read it, but it was a really telling article about how, you can feel the unfairness of people who are poor and working really hard, feel like they're paying for people who are poor and not working really hard. And there's dispute to that, but it was a very visceral thing. And where he sort of landed was that Medicare was kind of the common ground, but it was sort of painful to read because people's lives are so difficult, and you lose that at the policy level. So I'm wondering sort of how you factor that in.
Well, the way that Obamacare was put together was the states could expand Medicaid to cover lower income workers, and then the exchanges would be available with deep subsidies for people. The problem, and I admit, and the Obama people would admit, they probably didn't get the subsidies deep enough. The structure, though, ought to be able to handle that. And Governor Kasich has done a good job of expanding Medicaid. The problem is, once you go from Medicaid, which is basically almost free, to the exchanges, you have to pay something. And you're still talking about working class Americans who haven't paid anything before, and you're talking about their weekly income of deducting something for health insurance. And the $5 story I told about the elderly, when you're talking about people that don't have a lot of money, they're very price sensitive. And that means that even though health care may cost them $100 a month, if they're only making $9,000 a year and payroll taxes are being taken out, $100 a month is the difference between buying their 3 kids shoes that month, or everybody going out for dinner, or buying food for the table. So that, what seems to middle class people like not much money for health insurance, if you're living paycheck to paycheck, that really does make a difference. So that's what I mean by getting the subsidies right. I don't think the structure is wrong. I think we may have to have deeper subsidies for that family.
Right here.
Thank you. Thanks so much. So first, you have tremendous optimism, and so I'd like to know how, with what's going on, you seem to still be very optimistic.
Yeah, maybe
at
it's
least.
because I actually know Donald Trump.
Oh, okay. Well, we'd like to hear more about that. But also, how you envision the healthcare system, especially with these tax cuts that are going to be going on, and how they're putting in these things maybe in the next tax reform, quote unquote, that may really hurt the Affordable Care Act, Obamacare, and other things. So how do you see this actually coming down the pike, particularly if you know Donald Trump, and what he says he wants to provide health care for all. He says he wants to lower drug prices.
Everybody doesn't know anything about
But
the bills
he knows
people are
nothing
drafting,
about
yeah.
it, and the people he's putting in seem to be so opposed to it. So where do you see this coming out with your optimism? Because we need some of that.
Well, first of all, we've lived through some of these bleak periods before. It's very difficult to roll back a major entitlement once you've given it. I can't think of one that's ever been rolled back. Congress probably has the votes for some fixing of Obamacare if their leadership would let them loose on that. I don't see the tax bill I think the tax bill is a problem for a number of parts of our sector, but I don't know what it is yet. because they haven't negotiated it. And frankly, the lobbyists haven't weighed in yet. And remember, some of the most powerful lobbyists in Washington are healthcare lobbyists. I mean, the one advantage of having a private healthcare system is that you have very powerful interests. So the housing people, and I sit on the board of a major private housing, not private, but a public company, the largest home builder in America, they've already weighed in on the mortgage deduction. And I expect different sectors to weigh in before we have the final tax bill. There are some things in the tax bill I like. I like the child tax credit. I like doubling that. I would triple it. But you can see where both parties would come together on something like that. I don't know whether the Democrats are going to get into the negotiations at some point, but the political system is going to mess the thing up because all the interests are going to weigh in. And if you thought the healthcare interests were strong, watch the tax interests, because those are real professional lobbyists for the industries in particular, and for healthcare in particular. So I'm not as worried as other people are. CMS could cause some problems, but look at the problem they caused already. They cut the money for advertising the Affordable Care Act, and we got an increase in applications. Because once you talk about something a lot, suddenly people recognize it. We got a huge increase in applications without the money, shortening the time frame. Now, the healthcare industry has a stakehold. They're telling everybody to sign up. I live in South Florida. Everybody in Hialeah has signed up. Literally, everybody in Hialeah that's eligible has signed up. Why? Because all the Cuban clinics got them to sign up. Because it's a working class town, and they got everybody to sign up. The hospitals are signing people up. The clinics are signing people up. The infrastructure is moving. But we cut that, and everybody thought it was going to be a disaster. They cut the amount of time people have to sign up for the Affordable Care Act, and we've got an increase in applications. So you tell me. Sometimes you can't predict these things. Why am I optimistic? I was born optimistic. I was just born optimistic. I refuse to give up. I'm one of these people, if I hit a brick wall, I turn around and find something else to do. Some other brick wall to break down or something. No. But we will get through this, and I have considerable confidence. Who knows? The Senate could flip. We got a little activity going on in Alabama. To Mitch McConnell's credit, he said he believed those women. I mean, you just never know when the world's going to change. You just never know. You can't predict this. So you have to keep optimistic. More importantly, we have to keep working. We have to keep taking advantage of what we have.
So this optimism, this being prepared, is how I sort of look at part of this, how to be prepared to take advantage of any opportunity that exists. I thank you for being here. Thank you for sharing your wisdom. Thank you for sharing and all you have done
Thank you.
to help all of us.
Thank you very much. Very nice.